Good morning. We're here this morning in City Hall with Mayor Lowe, our Commissioner from Russell County, Chairman Corbett, and our practitioner with Preferred Medical Group, Dr. Chandra. We're here this morning to talk about COVID and the concern we have in Alabama and particularly in Russell County. I've got several questions for our panel this morning, and I'm going to begin because we're in City Hall this morning with Mayor Lowe. Mayor Lowe, thank you for taking your time out of your busy schedule to be here today. I know you're very busy. Tell us what your message is to the people today about COVID in Phoenix City.
Well, first of all, really, we certainly thank you and Dr. Chandra as well as Chancellor Corbett for being able to have a community that really cares to be able to step forward to let people know the importance of this. There's two ways that we learn, one by knowledge and one by experience. And this is something that is happening that we hope people doesn't have to learn by experience. We've already seen the past. It's vitally important that we encourage people from a leadership standpoint to take the vaccination. Now, I know some people may say we're crossing the line, but as we look at the data, and I'm quite sure Dr. Chandra can address this a little later, it's real and it's important. And with Phoenix City, within Russell County being the lowest in the state, it is very mission critical that we encourage people to do what they need to do, not just for themselves, but for the people that are around them and their family also. So I'm grateful that we have this opportunity to do this, and I'd like to say thank you all so much.
Thank you, Mayor Lowe. You're exactly right. We're blessed today to have Commissioner Chairman Corbett with us. We are blessed to have him in many ways. He serves many roles. He is retired EMA Director with Auburn, and he's currently serving as EMA Director in Muskogee County. But we're blessed to have him as Chairman of Commission of Russell County. So he is eminent as Russell County goes from the Lee County line all the way down to the Barber County line, and is a very big county. Commissioner Corbett, thank you for being here. I know you're extremely busy this morning as well as Mayor Lowe. Please share with us what you'd like to tell the people of Russell County.
Well, first off, I'm happy to be here. And as I mentioned as we started this, all of us in the room have been vaccinated, and we've taken our mask off because we've tried to socially distance as we started. But, as the mayor said, we do care, and we want all of our citizens to be as safe as possible. I speak for 7 county commissioners in Russell County, and we have taken steps, any steps that we can to prevent the spread of COVID. As far as vaccination clinics, we encourage them. We want them. We've held some. There was one this week in Hurtsboro. We've had them in Mount Olive. We've had them in Phoenix City. We've had them all over. So we want to do anything we can to keep our citizens and their families and even our neighbors as safe as we can. It is a dire time. Our hospitals are filling up. Our hospitals are, our healthcare workers are going through times that is very tough for them. So anything we can do to promote vaccines, get people to be safe in these times is something we want to do.
Thank you, Chairman Corbett. We're just blessed to have such a working group in Russell County and Phoenix City to help reach our people. Dr. Chandra, I know you are on the front line of this, and you know more about this than probably any of us in the room. You're an extremely talented practitioner in our area. We're blessed to have you in your practice. Please tell us today why this is a priority and why you have made this a priority in your practice in our area, East Alabama.
So, COVID came out of left field. I think nobody was really prepared for it, and it's been challenging because millions of lives have been lost around the world, in the United States, in Alabama. And I think we have the opportunity to beat COVID, and vaccines is the only way to beat it. However, it's been disappointing that our population is somehow not embracing the vaccine in the numbers that we want them to. And my job is twofold. One, I want to be a resource to the community. Any parent or any adult who wants to have a discussion about why they have reservations about the COVID vaccine, come talk to me, or talk to your own personal physician. And it's important to share with everybody that 96% of physicians took the COVID vaccine. So if you think about it, physicians are people who know how to read the literature, who know how to interpret the studies. They're pretty smart people. And the message is that let's embrace medicine and science. There is no place here for religion and no place for politics. No Democrats, no Republicans, no Trump, no Biden. It's all about science and medicine.
Good point. Commissioner, thank you for that. Commissioner Corbett, you represent a lot of rural communities in Russell County. Tell us, I know there's some limitations and logistic issues with some of the citizens of Russell County. Tell me how we might could remedy that to help the Russell County citizens deep in the pockets of Russell County.
Yes, so as I mentioned before, we have already had pop-up clinics. I was very pleased to hear from Dr. Chandra this morning as we got here that they now have a mobile clinic that can go around. We're encouraging her to come to Crawford for our market days. We've got a Labor Day fair coming up in Seal, something we can talk about, and anything we can do. So yeah, you're right, it's rural. We have given a lot of ability. You know, when we've had clinics already here at Jack Houston Hospital in Phoenix City, we had a lot of the rural residents come to that. There was a huge clinic right across the river at the Civic Center, and they didn't care where you were from. They just let you come right through. I know I had family members, friends that went there. So, and maybe we haven't captured those numbers as good because it was in Georgia, but I think it's important for us to realize that if there's a need, we will find the ability to do it. We had some money, a grant that came through just recently, and in that grant, we actually put in for a mobile trailer that will carry equipment to help us do pop-up clinics. And with Dr. Chandra's mobile clinic, maybe we can kind of supplement that and make it work even better.
That's great. That's wonderful. I look forward.
Go ahead, you go ahead.
Dr. Chandra, you have a clinic in Russell County, down in Fort Mitchell in that area.
Correct.
Tell us, is that clinic able to serve that part of the county and ready to go?
Absolutely. The Fort Mitchell Clinic is a rural health clinic, and we are there to serve the population of Russell County. And we're happy to go out to the schools and set up vaccination clinics. We're happy to go out into the county to set up vaccine clinics, but we need shots in arms. If we don't do the shots in arms and this virus continues to circulate in the community, we also have to realize that this is not just personal, it's about all the people surrounding us. So the longer the virus stays, the more opportunity it has to mutate, and that's why I brought you this little example, okay? So the vaccines that we have currently, the mRNA vaccines, they target the spike protein here. And the new Delta variant has had a change in the spike protein, and that's why we are having cases where they've had the vaccine and still getting sick because the virus did a number on us. So the faster we beat the virus, the less the chance it's going to mutate and come up with another ugly variant.
Okay, great. Tell us, I know you're talking about the variant, and now we're hearing about the Delta variant. Tell us, or explain, or help you understand, and help us understand, and our citizens understand, how and why is this affecting our children this time around? The first time it was older Americans and citizens. Now it seems to be hitting our younger population.
Somehow the Delta variant has made its way and mutated to the point that it is really affecting the children. When the first wave of COVID came, children were not as sick, but now we've had about 360 or 370 children nationwide that have died from COVID. Alabama actually has the highest rate of pediatric admissions. We have UAB children where there's 2 babies less than 2 years old who are on a ventilator, perfectly healthy previously. So the Delta variant is really affecting the children. I worked at Fort Mitchell Clinic yesterday, and it was crazy. I went room 1, room 2, room 3, all 3 were COVID positive.
And children?
Yes, wow. These are school-age children.
So tell us, with these 2 community leaders, Mayor Lowe and Commissioner Corbett, tell us how we can better serve this area and how we can get these shots out to our children. And how old do you have to be for these vaccinations?
So anybody 12 years of age and older is eligible currently. There is talk that by the end of September, it's also going to get approved for 5 to 11-year-old age group. But for now, ages 12 and up. I think the biggest thing is that we are making this a community priority and leading by example. Mayor Lowe took his vaccine very publicly on TV. Commissioner, you've had your vaccine, I've had my vaccine. We're all fine, we've not had side effects, and it's a good thing to get the vaccine.
Okay, is there a cost to these? If we set up vaccination sites throughout Phoenix City, Russell County, is there a cost to our citizens?
Zero cost. Just show up and we'll get you vaccinated.
Okay, great. That's wonderful. Thank you so much. Is there anything else you'd like to share with your citizens of Russell County, Commissioner Corbett?
You know, the only thing I will share, I've had conversations to piggyback on what Dr. Chandra said, even with family members about why get the vaccine. They're watching the national media, they're watching media, and they're hearing that people are still getting sick. But the reality of it is, I've had a close family member actually who was vaccinated developed COVID, but the symptoms were almost nothing. And I firmly believe that if he had not been vaccinated, he probably would not have survived, because he was in the hospital when he received COVID. So when he got COVID, and because of the vaccination, I believe he lived. So I think it's smarter to use the tools we have. The argument about it not being fully approved, it's coming. I appreciate the fact they didn't rush it, and that they got it out there as quick as they could, and they continued to study before they made it fully. It will be here soon, and I think we have proof that a lot of people that I know have had it and had no side effects at all. So I think we need to encourage people to get the vaccine. It is our best chance of getting past this.
Great, thank you. Mayor Lowe?
Yes, just to piggyback off of what already been said, listen, it is mission critical. It's vitally important that we take the vaccination. I mean, it is what it is. We see how to combat it. We have the professionals, we have all the data, we have everything out there. And with Alabama being the lowest in the union, we really need to step up, and we really want to start here in Phoenix City as well as in Russell County to be able to combat this, because the goal of ours is to make sure that we do our part to help eradicate this. And there's things that we have to do as leaders, provision, provide, but more importantly is to protect, which is the safety. And that's why we're here this morning begging and pleading that we all get on board to be able to help eradicate this, starting right here in Russell County and Phoenix City.
Thank you all so much. Dr. Chandra, your clinics are ready, shots are ready, your mobile clinic is ready.
We need the arms.
We need the arms. Okay, so we had briefly talked about our schools. Some of our schools have been involved to set up clinics. So it's any student, child in Russell County, Phoenix City, 12 and up, any family member, anybody in the East Alabama area. It doesn't matter where you live, if you're in the city or the county district. We've had all of our community leaders here this morning to help us get on board and get Russell County vaccinated. This is very, very important, and we plead for your help to help us achieve this mission by the holidays. Dr. Chandra, thank you for being here this morning, and your staff, Mayor Lowe and Commissioner Corbett. These are very busy individuals, but they have dedicated to get this done in Russell County.